Hey, it doesn't have to be a life sentence anymore. But knowing when to test, when to seek emergency prevention, and how to protect yourself can literally save your life. In this video, we'll cover everything you need to know about HIV exposure, testing timelines, PEP, how the infection progresses. Let's dive in. Let's start by understanding what happens when HIV enters your body. Within 2 to 4 weeks after exposure, the acute infection stage begins. During this critical window, the virus multiplies rapidly in your bloodstream. Many people experience flu-like symptoms during this stage: fever, headache, sore throat, swollen lymph nodes, fatigue, and sometimes a rash. These symptoms are often mistaken for the flu, which is why this stage is so dangerous. You're highly contagious during acute infection because viral loads are at their peak. After the acute stage, HIV enters a chronic phase, also called clinical latency. During this period, which can last 10 to 15 years without treatment, the virus is still active but reproduces at much lower levels. Here's what makes this stage tricky. Many people feel completely normal, no symptoms. You might not even know you're infected. But the virus is silently damaging your immune system, and you can still transmit it to others. Throughout this stage, your CD4 cells, the immune cells that HIV attacks, gradually decline. Without treatment, this stage progresses to AIDS. AIDS is the most advanced stage of HIV infection. It's diagnosed when your CD4 count drops below 200 cells per cubic millimeter, or when you develop certain opportunistic infections. At this stage, your immune system is severely damaged. Common AIDS-related conditions include pneumocystis pneumonia, tuberculosis, severe candidiasis, certain cancers like Kaposi sarcoma, and significant weight loss. Without treatment, survival time is typically about 3 years. But here's the crucial message. With modern antiretroviral therapy, HIV is manageable. People with HIV who take their medication as prescribed can achieve an undetectable viral load, live normal lifespans, and cannot transmit the virus sexually. This is called U=U. Undetectable equals untransmittable. In Ghana, HIV testing services are widely available and accessible. According to our national guidelines from the Ghana Health Service and the National AIDS STI Control Program, all health facilities should offer HIV testing services. You can get tested at teaching hospitals, regional hospitals, district hospitals, health centers, and even CHPS compounds across the country. Community-based testing is also available, making it easier to know your status. Ghana has also introduced HIV self-testing kits as part of our national HIV response. These quick self-test kits allow you to test yourself in the privacy of your home. The Ghana Health Service rolled out these kits in 2023, and they're now available in many communities across the country. The kits come with video instructions in English and 6 different Ghanaian dialects, making them accessible to everyone. If your self-test result is reactive, you must visit a health facility for confirmatory testing. According to Ghana's national HIV testing guidelines, everyone should know their HIV status. Testing is particularly important for certain groups. All pregnant women should be tested at registration for antenatal care. Sexually active adults, especially those with multiple partners or recent STI diagnosis, should get tested regularly. Partners of people living with HIV, those who inject drugs, and anyone who requests a test should be offered testing without discrimination. The good news is that HIV testing is free for all Ghanaians with a valid national health insurance. Even without NHIS, lack of insurance should never be a barrier to getting tested. Understanding HIV testing timelines is crucial because different tests can detect HIV at different times after exposure. The window period is the time between when HIV enters your body and when a test can reliably detect it. During this time, you can still transmit the virus even though tests may be negative. The Na2 or nucleic acid test can detect HIV the earliest, typically 10 to 33 days after exposure. It looks for the actual virus in your blood. However, it's expensive and rarely used for routine screening. The antigen antibody test done through a blood draw is the most common. It can detect HIV 18 to 45 days after exposure. This test looks for both HIV antigens and antibodies your body produces. Antibody-only tests, including rapid tests and home tests, like the Quick kits available in Ghana, take the longest to detect HIV, typically 23 to 90 days after exposure. These look only for antibodies, which take time to develop. After a potential exposure, here's the recommended testing schedule. Get tested immediately for a baseline, then at 2 to 4 weeks, 3 months, and if you used PEP again at 6 months. This ensures you don't miss an infection during the window period. PEP stands for post-exposure prophylaxis. It's emergency medication that can prevent HIV infection after potential exposure. But time is critical. PEP must be started within 72 hours of exposure, and the sooner, the better. Ideally within 24 hours. You should seek PEP immediately if you've had condomless sex or condom failure with someone who is HIV positive, or whose status is unknown, shared needles or injection equipment, occupational exposure, like a needle stick injury in healthcare settings, or experienced sexual assault. In Ghana, PEP is available at all our 8 sites, teaching hospitals, regional hospitals, district hospitals, and many health centers. Don't wait. Don't hesitate. If you've had a high-risk exposure, seek medical care immediately at the nearest health facility. PEP involves taking antiretroviral medication for 28 days. These drugs prevent HIV from establishing infection in your body. You'll typically take a combination of 3 medications once or twice daily. According to Ghana Health Service guidelines, PEP is provided free of charge at all designated sites. The success rate is over 80% when started promptly. Remember, PEP is free under the National AIDS Control Program. Your health comes first, so don't let cost concerns stop you from seeking help. Now, let's talk about PrEP, pre-exposure prophylaxis. Unlike PEP, which is used after exposure, PrEP is taken before potential exposure to prevent HIV infection. Think of it as a safety net. PrEP is recommended if you have an HIV-positive partner who isn't virally suppressed, have multiple sexual partners, and don't consistently use condoms, have had a sexually transmitted infection in the past 6 months, share needles or injection equipment, or engage in high-risk sexual practices. Ghana has scaled up PrEP services across the country. Over 15,000 Ghanaians received PrEP between 2022 and 2023 through our national program. PrEP is available at designated health facilities, particularly those providing ARTS services. Starting PrEP requires an HIV test to confirm your negative kidney function tests and screening for other STIs. You'll need follow-up appointments every 3 months for retesting and monitoring. PrEP does not protect against other sexually transmitted infections, so regular screening and condom use remain important. Let's recap the critical points for Ghanaians. 1. After potential exposure, time is everything. PEP must be started within 72 hours, the sooner the better. It's available free at all ARTS across Ghana. 2. Testing has window periods. Don't rely on a single negative test too soon after exposure. Follow the recommended testing schedule. Remember, HIV self-testing kits are now available in Ghana. 3. PrEP is a powerful prevention tool for people at ongoing risk. Talk to your healthcare provider at any RT site or designated facility if you think you might benefit. 4. HIV is treatable. With proper medication available free through the National Health Insurance Scheme, people with HIV live long, healthy lives and cannot transmit the virus when virally suppressed. 5. Regular testing is crucial. All pregnant women should be tested at antenatal registration, and everyone else should know their status. Testing is free and confidential at all health facilities in Ghana. Knowledge is power when it comes to HIV prevention and treatment. Whether you need testing, PEP, or want to discuss PrEP, resources are available throughout Ghana. Don't let fear or stigma stop you from protecting your health. Visit your nearest health facility for confidential HIV testing and counseling. You can contact the National AIDS STI Control Program or Ghana Health Service for more information. Remember, all CHPS compounds, health centers, and hospitals offer testing services. If you found this video helpful, please like, subscribe, and share it with someone who might need this information. Your share could literally save a life. Drop any questions in the comments below. Let's keep the conversation going and end the stigma around HIV. Remember, test, prevent, treat, live. This is Dr. Anim, and I'm here to make health simple. Thanks for watching and take care of yourself.